Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.
You're listening to Healthcare Matters, the podcast that pulls back the curtain to help you make sense of complex healthcare economics and policy issues. With us, as always, is my partner in crime, Dr. Robert Popovian, tuning in from Washington, D.C. He's a pharmacist, he's an economist, and he's the Chief Science Policy Officer at the Global Healthy Living Foundation.
And joining me today is my good friend, Connor Mertens from Seattle, Washington, my co-host, and our patient advocate and community outreach manager at GHLF. Connor, today we have a special guest, David Balat. We're going to dive right into his episode, but before we start, as always, I'm going to ask you a question. So, Connor, if I ask you what the number 41% represents, what do you say?
I actually know this one. We were just talking about this, and I just read about it. It has to do with the healthcare debt, right?
Unfortunately, that's correct. The main cause of bankruptcy remaining constant over the years in the U.S. is job loss and medical expenses. It was recently reported that 41% of U.S. citizens carry some sort of medical debt, and even worse, 24% are considering bankruptcy to solve the medical debt issue. So this is an excellent transition to our guest, who is an expert on all things related to healthcare financing, specifically on hospital issues and hospitalization costs, and today's hot topic. So let's get started. So we've discussed the topic of transparency on this podcast multiple occasions, specifically focusing on drug price transparency. And today we're going to explore a bit further. We're going to look at a lack of transparency in the hospital pricing and hospital costs and how it impacts patients. With us today is my good friend, someone I've known for many years, David Balat. Welcome to Healthcare Matters, David.
Thank you for having me, Robert.
Excellent. David, you and I have known each other a long time. You have a robust background in healthcare. You are the founder of the Healthcare Finance Specialists, and you worked in the hospital marketplace for a long time. Why don't you give our audience a little bit of an introduction? Let us know about what you're doing in the past, present, and what you plan on doing in the near future.
Wonderful. I appreciate it. And thank you both for having me, Connor. I appreciate the opportunity as well. You know, I grew up in the hospitals. I had aspirations of becoming a physician and worked in the hospitals as soon as I was able to have a job, and worked just about in every department throughout, and various types of hospitals as well, community, rural, academic, you name it. And I really gravitated more towards the administrative side of it as opposed to the clinical. And so that's where I got my education and really hit the ground running as soon as I finished with my postgraduate work, and have been a healthcare executive and hospital CEO for nearly 20 years before moving into public policy, and have worked with different administrations. I've continue to still work with lawmakers at both the federal and state level in various states, helping them understand how healthcare really works, because there are a lot of folks out there that are experts or specialists of sorts that really have not worked in the industry. So I feel that folks like Robert and myself and people who've actually gotten their hands dirty offer a different perspective to those individuals, to those people making decisions and their staff on how things really work. And I've gotten back into, started my consulting firm again, Healthcare Finance Specialist, and I'm working with independent practices. I'm working with employers. I'm working with as many people as I can, different organizations, to help them understand how you can access affordable, high-quality healthcare, regardless of where you are in this country. One of the projects that I'm excited about is my partnership with the joint venture between Lasso Health and Walmart Health. And they're offering a very robust telemedicine product, I should say, that will address medical care, urgent care, and talk therapy for price points that are as low as $20 a month per person and $40 for an entire family. They're getting into the drug business, the prescription drug business, rolling that out here very shortly. And then next year, we're looking at addressing lab cost and surgery cost and a number of other areas that affect everybody, and how we can get upfront pricing for those individuals, for those organizations that are the ones ultimately paying for healthcare.
I mean, that's amazing, David. Definitely a thorough resume, as Robert had mentioned. But as another thing Robert mentioned, we discuss the topic of transparency often on this show. It's something that's so foundational to the work that we think can improve healthcare. Especially, we talk about how lack of price transparency for medicines reduces competition and ultimately hurts patients. And then they overpay for life-saving therapies, and even discussions about transparency in the 340B program. Can you please discuss the lack of transparency in hospital pricing?
Yeah. Let's go back to the last administration. I was in the White House in the time that they were working on the executive order under the Trump administration to roll out the hospital price transparency rule. And I was very happy to see the Biden administration continue in that effort. It was one of the few executive orders that wasn't rescinded. So that's been a positive. The hospital industry, the American Hospital Association, fought this rule tooth and nail, sued it to the highest court, and they lost at every level, which we were very, very pleased with. One of the main arguments was people don't really care. People won't use price transparency. And, honestly, that may be the case, but it's just been so hard to access that it hasn't been used because it's not available.
So, David, we talked about patients, the impact on patients, on price transparency and spending. You just alluded to how the administration, both the Trump and the Biden administration, have championed this for the hospital transparency. What are the employers doing? Because, sometimes in healthcare, it's almost like the silent majority. But what are they doing? Are they fighting for transparency? Are they not? I mean, you're starting to work with them more directly now in your new position. So what are you seeing?
They're in a tough spot because if you go into business and you start a company, you don't expect that your number 2 or number 3 or your number 4 budget line item is healthcare benefits. Everybody is getting into the business of healthcare. That's not their expertise. It's not what they know. They're just trying to perform the business that they got into. So it's not something that they pay a lot of attention to. They're thinking the insurance company or their third-party administrator will do the job for them. But the problem with that is, given the amount of money that they're putting out every month, every year, it's something that they're now really having to pay more attention to. Even more so, if you're a self-funded plan, it is your legal duty. You're a fiduciary under the law, under ERISA, to make sure that those dollars are being used at their best and highest use. Now, let's just say for those that aren't self-funded, let's just say an employer is just fully insured and all they're doing is paying the premiums every month. It still behooves them to get involved in price transparency because the high cost of healthcare in hospitals across the board is making it so that people are avoiding getting the care that they need. And if they get sicker, they're losing more work, and it's bad for the employers as well that way. So it's important regardless of the way that they're providing this benefit, but you're exactly right. They're an important piece. If they were engaged in this fight more so than they are today, we wouldn't need Washington or state governments to be involved. It would get done because of the market.
Terrific. I don't disagree with you. I completely agree. I think a lot of ways if employers were more engaged on this issue, but it is difficult. And they are in a hard place because they're not in the business of healthcare. They're in the business of manufacturing, tires or clothing, right? So they didn't get into those businesses to manage healthcare for their employees.
Right. I just wanted to address one other point about the price transparency and where people are getting it wrong. Some of the arguments against transparency are, well, if I'm in the back of an ambulance and I'm being headed to the hospital because of an accident or a cardiovascular event, I'm not going to call and ask about the price. That's true. That's exactly right. Nor should you. But nearly 80% of all healthcare services are elective. They're scheduled. So we're talking about those things that you can anticipate and that you have time to deal with.
You're so right. I mean, every time I've been in meetings when issue of hospital price transparency has come up, you get this apoplectic response from the hospital executives, and they bring up that extreme example, right? If you're in a car accident, you're not going to go look for pricing. You're just going to go to the closest emergency room or the hospital for treatment. But there are a lot of services, including, for example, maternal care, that can be planned ahead of time. And patients can make better choices if they had the information. But let me ask you something, because this is something that always comes up. Do you believe that patients can save money if there was truly hospital price transparency in the marketplace?
Sure. Let me give you a really easy example. Well, before I give you the example, let me just give you some statistics. The average deductible is between $5,000 and $6,000 in this country. 60% of all Americans have less than $1,000 in their savings account. Now, if I have an order for a CAT scan, and let's just say I have insurance, and there are 2 hospitals that are in my network, both relatively close to my home, and I can call up and say I need a CT of the head without contrast. Hospital A is part of a system. They're able to leverage their market power, and they're able to secure higher rates from the insurance company. Let's just say for my insurance, they're able to get $2,000 for that CAT scan. Hospital B is maybe one or two hospitals, they don't have that leverage. They're not able to negotiate. Same CT, same equipment, probably the same radiologist reading it. They're able to get a contract for $1,000. With that knowledge, and given the fact that I have a deductible of $5,000, so this is all out of my own pocket. I'm a cash payer. Where am I going to go? That is an example of knowing the price in advance, being able to secure that information. It betters me financially. It betters my family financially. And I'm able to have peace of mind. And frankly, it's given me an agency in the process, which most people don't feel that they have when shopping for healthcare. If a doctor gives you an order and says, go to this place, you go to this place. You have it done, and then you hope for a bill that's reasonable.
Terrific example. Great example. Let me move a little bit back to another topic that I've always talked about, consumerism in healthcare. When I say those words, consumerism in healthcare, what is the first thought that comes to your mind?
Well, I immediately think, what is the contrast? So I have to think of what the contrast is to consumerism. The contrast is government-run healthcare, much like the VA or what we're seeing in Canada or the NHS. There's a lot of rationing. There's a lot of being told what you can and cannot have, depending on what condition you're in or what age you are. Consumerism, on the other hand, again, gives agency. It gives a sense of control to the individual. It gives them the ability to find the product that they want, the service that they want at the price that they need. That's what consumerism is. Unfortunately, we don't have true consumerism in healthcare yet, but that's the direction we would rather move into as opposed to the contrast.
Thanks for clearing all that up for us. I'm super curious, since I work really closely with our patient community. I guess my question's a little bit of follow-up to that. And how do you think that these things that you and Robert are discussing about consumerism in healthcare will benefit patients?
Well, it's just like I said, it gives them a sense of being in charge, and it gives them peace of mind. Many people don't get the care that they need because of a fear of what it'll cost. Now, affordability and high quality is not just a theory. It's not a pie in the sky kind of idea right now. It's happening. Much like what I discussed that's happening between Lasso Health and Walmart Health in their joint venture. If you look at Surgery Center of Oklahoma, you can go to their website, and if there's an ear tube removal that you know that your child needs to have, you can go to their website and it'll give you the price up front for the facility, the doctor, and the anesthesia. It's an all-in bundled price. That's the direction that transparency really should be going in the future. Right now, it's unbundled. There are a lot of different codes. It's confusing. It's difficult to ascertain what that price will be for this procedure or that procedure. But at some point in the future, I do think that we'll be moving in the direction of having prices that are consistent with a procedure type. Now, there will be some variation because people come in with different risk acuities, like different risk factors, which could make the surgery end up going much longer, which would therefore result in a different, more expensive price, which behooves us all to stay as healthy as we possibly can. But that's the direction that we're moving in, I think, for healthcare, because the thing that we should all share is having the government be in charge of healthcare. We see what they're doing with trying to control drug pricing, and that's not going very well at all. And in fact, they may be harming the development and innovation of medications, not just in our country, but across the world.
All right, David, let's go back to bankruptcies. Can you just give us an idea of why this is all happening so much in the U.S.? Who are the major players involved in that?
That's a multifaceted response to that. It's not a simple question, but one of the things that is under a lot of scrutiny right now are the nature of what charity care is that is provided by tax exempt or nonprofit hospitals. I prefer tax exempt. Many, under federal rules, nonprofit hospitals are required to provide community benefit. That doesn't necessarily mean charity care or reduction in the charges for what services are offered. And in fact, we did a research study on the hospitals in the state of Texas, and we saw that it was relatively even between for-profits and nonprofits in how much charity care was given. But many of the nonprofits will say, well, we provide education and we provide a number of different tools that fall under our community benefit requirement. Most other companies would call that marketing. So their billboards, their kiosks at a fair, or whatever the case may be, they're providing information to try to get you to see their doctor or come in and use their services. That's not as much community benefit as far as I'm concerned as it is just a marketing effort. So I think that there needs to be some changes to the definitions in federal law and maybe even a look at the state level for how charity care can be provided to benefit these patients that would be close to the benefit that they receive and not having to pay taxes.
Yeah, thanks, David, for sharing all that insider knowledge. And on this podcast, we have a tradition. Robert, you know you got the last word.
Well, I have to say, David definitely is an expert on the hospital side. I'm an economist, and I have to tell you, in every other segment of the healthcare system, transparency, price transparency always creates competition and lowers prices and lowers costs and lowers spending. Somehow or another, the insurance industry, the pharmacy benefit management companies, and the minions and the economists and the minions that they pay off have sort of bamboozled everyone to think that transparency will hurt the healthcare system, that in fact transparency will drive up costs and drive up spending and drive up utilization, and it's utter nonsense. We need more transparency, we need more consumerism in healthcare, whether it's in the hospital services or in drug pricing and drug spending. The only people that are going to benefit from this is the consumer, the actual payers who pay for healthcare in the United States, the taxpayers, the patients. And the people who try to protect and create a opacity in pricing and transparency and basically fight transparency are the ones that are benefiting handsomely from the current model, which are primarily the insurers and the pharmacy benefit management companies. So thank you, David. I want to give him my personal thanks for coming on our podcast.
Well, yeah, thanks, David. Thanks, Robert, for breaking that down for us. I think that was quite a look behind the curtain. Definitely some valuable information for our listeners in there. And to our listeners, don't forget to subscribe to our podcast on Apple, Spotify, or wherever you might be listening so you never miss an episode. And if you have a second, help spread the word by rating the podcast, writing a positive review, and sharing with your friends and family. It'll help more people like you find us.
If you have any questions, thoughts, or suggestions, as always, you can send it to us on email at podcasts@ghlf.org. And we always are looking for new ideas, and we may include you or feature your question in one of our upcoming episodes.
And before you go, make sure to take a look at some of our other great podcasts on the GHLF Podcast Network. And you can find all of GHLF's podcasts at ghlf.org/listen. As always, he's Dr. Robert Popovian.
And he's Connor Mertens. We'll see you all next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.